Today I am going to discuss about the diabetic keto acidosis. I have some flowchart here and the treatment for the diabetic keto acidosis is there. I will explain everything in detail about the diabetic keto acidosis. Just be with me. Diabetic keto acidosis. It is seen in type 1 diabetes mellitus patients. Because in this patient they will have decreased insulin levels. That means their pancreatic beta cells are can't able to release insulin. Because of that there is decreased insulin levels. Insulin is not there. What happens when insulin is absent? See here. Normally, the insulin, what it does in our body is, for example, take a cell from the skeletal muscle and the adipose tissue. For example, this is the cell from the skeletal muscle and the adipose tissue. Normally, in the cytoplasm, they will have GLUT4 receptors. GLUT4 transporters. What the insulin does is, these insulin translocate the cytosolic GLUT4 receptors onto the cell membrane. These are the receptors. So that there will be increased absorption of glucose into the cell. Because of that, what happens? In the plasma, glucose level will be low. Because of the lack of insulin, this function will not happen. That leads to hyperglycemia. Okay, then not only this one, the insulin increases the absorption of glucose into the liver, so that the glucose is converted into, the many glucose molecules are converted into the glycogen. So that what happens? The glucose levels in the blood will be reduced because of this uptake. This is the normal function of the insulin. Because of the lack of insulin in the diabetic ketoacidosis, this function will not happen. Further, it leads to hyperglycemia. Okay, in the liver only, the production of glucose from the non-carbohydrate sources like alanine, lactate, some amino acids, all these are converted into the glucose in the liver. This process is called gluconeogenesis. Normally, insulin inhibits this process. When insulin is not there means glucose neogenesis process is increased, so that the glucose concentration is further increased inside the blood. That will contribute to the hyperglycemia. Okay, then insulin in the muscle, there will be increased amino acid uptake, so that there will form the proteins, and also increased glucose uptake. These things will not happen. The glucose uptake will not happen. That leads to the hyperglycemia when insulin is deficient. These are the things that leads to, when insulin is not there, that means there is no translocation, that means there is no absorption of the glucose, leads to hyperglycemia. Then there is no formation of the glycogen, there will again hyperglycemia. There is no inhibition of gluconeogenesis. That means gluconeogenesis will happen in the absence of insulin. That leads to hyperglycemia. All these will contribute to the hyperglycemia. See, insulin deficiency leads to hyperglycemia. This hyperglycemia leads to glycosuria. What happens in the renal tubule? For example, take this as a renal tubule where the urine is processed and eliminated. These are the cells. These cells reabsorb the glucose and taken back into the blood. This one is blood. Okay. Normally the glucose is reabsorbed by the sodium glucose cotransporter. These glucose is reabsorbed like this. In the renal tubule, the glucose concentration is increased. It is saturated. Sodium glucose cotransporter carrier is saturated so that the amount of glucose can eliminate. That leads to hyperglycemia. This hyperglycemia is so much so that the glucose concentration in the renal tubule is increased and exceeds the capacity of reabsorption. Glucose concentration in the renal tubule exceeds the capacity of the reabsorption, so that the glucose is eliminated in the urine, so that there will be glycosuria, and it will have osmotic diuresis. Because of the glucose in the renal tubule, it will drag more amount of ions into the tubule. These ions are sodium, potassium, manganese, all these are dragged inside, and water is also. These all will eliminate in the urine. The water, glucose, sodium, potassium, manganese, all these are eliminated. So that what happens? There will be loss of electrolyte. Loss of sodium leads to hyponatremia. Hyponatremia leads to hypotension. Hypotension leads to shock. See, hypotension, shock. Loss of potassium. Here main thing is for example, take this, here is a blood and these are cells. When there is loss of potassium in urine, the potassium inside the cell is mobilized into the blood, so that the intracellular depletion of ions. You can see here the intracellular depletion of ions. That leads to intracellular dehydration also. Are you getting my point? Because of that there will be intracellular depletion. All these things leads to hypotension, shock and the tachycardia. Why tachycardia is the potassium levels are increased here because of the mobilization of intracellular to the blood. This potassium leads to tachycardia because of increased potassium concentration. This about the hyperglycemia. Moving on to the fatty acids. What happens to the fatty acids in deficiency of insulin? See here, normally during fatty acid synthesis, the acetyl-CoA is converted to malonyl-CoA by the enzyme acetyl-CoA carboxylase. During fatty acid synthesis, normally insulin activates this enzyme. Normally insulin will activate this enzyme, and so that malonyl-CoA levels are increased. These malonyl-CoA inhibit beta oxidation, that means degradation of fats. It inhibits the fatty acid degradation. By inhibiting the enzyme carnitine acyltransferase 1. This is normal, occurs when insulin is there. What happens when insulin is not there? That means insulin deficiency. The acetyl-CoA will not, because of insulin is low, it will deactivate this enzyme acetyl-CoA carboxylase, so that I will show you with this pen, so that malonyl-CoA levels are low. This malonyl-CoA cannot inhibit this enzyme. That means carnitine acyltransferase 1 enzyme activity is high. It is an enzyme of fatty acid degradation. So that what happens? Fatty acids will be degraded. When fatty acids are degraded, the product formed in the fatty acid degradation is acetyl-CoA. The product formed in the fatty acid degradation is acetyl-CoA. I will repeat. When insulin is deficient, it will deactivate this enzyme. It will deactivate this enzyme so that the malonyl-CoA levels are low. These malonyl-CoA will not inhibit this carnitine acyltransferase 1 enzyme because normally malonyl-CoA is an inhibitor of CAT1. When malonyl-CoA levels are low, that means there is no inhibition of carnitine acyltransferase 1. So the carnitine transferase activity is high, so that there will be fatty acid degradation. Fatty acids are degraded, that acetyl-CoA levels are high. When insulin is not there, you can see acetyl-CoA levels are increased when insulin deficiency. This acetyl-CoA enters into the TCA cycle. Acetyl-CoA enters into the TCA cycle. Normally the acetyl-CoA is levels are so much high that it exceeds the capacity of TCA cycle. So that these acetyl-CoA levels, acetyl-CoA is converted into ketone bodies, so that there will be the ketosis. If you can't understand all these processes, remember insulin deficiency leads to increases acetyl-CoA. This leads to the ketone body production. The TCA cycle will also happen, but the acetyl-CoA levels are so much high that it exceeds the capacity of the TCA cycle. So it is diverted to the, not diverted, it also undergoes ketone body production. So that there is ketosis. What are the ketone bodies? We have 3 ketone bodies. These are acetone, acetoacetate, and beta hydroxybutyrate. This acetone will not yield energy. This will not yield energy. Normally it is useless. It is eliminated through the respiration. That means acetone is exhaled out. This acetone, because of this acetone, they will have fruity odor. Okay, this acetone, acetoacetate and beta hydroxybutyrate, these two will yield energy. That means they will yield ATP. All these are acids, so that they will have metabolic acidosis. Are you getting my point? Metabolic acidosis. To compensate this metabolic acidosis, our body stimulates the respiratory center so that we have hyperventilation. This metabolic acidosis stimulates the respiratory center so that we have the hyperventilation. What happens in the hyperventilation is, in metabolic acidosis, acid means carbon dioxide, is elevated in our body. In hyperventilation, what happens is, hyperventilation expiration time is more than inhalation. So that expiration time is more means carbon dioxide is washed out from the body. The carbon dioxide is washed out. That means acid is going out. In the metabolic acidosis, the acid is going out. That is the compensatory mechanism. That is about the ketone bodies. See here, ketosis. Because of the ketosis, they will have vomiting. This vomiting causes dehydration. Acidosis is due to the accumulation of acids. Compensatory mechanism is hyperventilation, and there is also water loss is there. Water loss from the respiratory route. That is also leads to dehydration. Then ketosis is cause impairment of glucose entry into the cell. so that they will have impairment of consciousness. See, dehydration also leads to dehydration. Means there will be because of the dehydration they will have hypotension, shock, and the tachycardia. These things will happen in the diabetic ketoacidosis. I have explained you every detail about this diabetic ketoacidosis. In the diabetic ketoacidosis, insulin is deficient, so that hyperglycemia is there. I have discussed about the why hyperglycemia in the insulin deficiency. Then also because of the glucose concentration is increased, they will have glycosuria, osmotic diuresis, intracellular depletion, hypotension, shock, tachycardia. In the ketosis, acidosis, hyperventilation, all these we have discussed. How do I treat this diabetic ketoacidosis? First treat insulin. First give insulin. All these manifestations are due to the insulin deficiency. So first give insulin. The treatment here is first give insulin. After that, because of this hyperglycemia, we lost ions. So give IV fluids. And most importantly, because of the potassium, we have tachycardia. To treat the tachycardia, give potassium chloride. That is the third treatment. Fourth one is because of the acidosis, give sodium bicarbonate. Then these patients, insulin deficient patients, that means hyperglycemic patients, are more prone to the infections. So give antibiotics. If you suspect infection, give antibiotics. This is the metabolic reasons for the diabetic ketoacidosis, and how do we treat the diabetic ketoacidosis. In exam, write in insulin about the manifestations. What happens when we give insulin? I will ask you a question. What happens when we give insulin? There will be translocation of glucotransporters and increases glycolysis process and increases glycogen process, inhibit gluconeogenesis, and all this promotes to the decreased glucose levels in the blood. So we have to give insulin. What happens when we give IV fluids? To treat what? Hypotension. So to treat tachycardia, to treat metabolic acidosis, to treat infections. All these are treatment modalities for the diabetic ketoacidosis. Okay, if you like this video, please support me.